My name is Dr Joseph Sgroi, an obstetrician, gynecologist and fertility specialist based here at Epworth Freemasons and also Melbourne IVF. I care for women, couples, single women, all the way through preconception, fertility, pregnancy, birth and the postpartum period. One of the greatest things we do as an obstetrician is take those first photos of your baby on an ultrasound scan, and often there's one heartbeat, but sometimes there can be two heartbeats, and often that excitement gives way to the realization that there will be double trouble soon enough. And so for us as obstetricians, we also acknowledge that there are some complexities that occur during a twin pregnancy that mean that we need to monitor your pregnancy a lot more frequently than would normally happen for one baby. This usually results in very frequent ultrasound scans throughout the pregnancy, at least every 2 to 5 weeks. And in addition to that, also more frequent visits to see your obstetrician, looking out for things like gestational diabetes, high blood pressure, and the growth of the baby. So you can normally expect that from 32 weeks onwards, you'll be seeing your obstetrician weekly. And that ultimately means that we're caring for you and your babies as best as we possibly can. I have the pleasure of caring for about 30 pregnancies over the course of a year that are twin pregnancies, and that's amongst about 400 women that give birth every year. We know that 1 in 84 pregnancies is a twin pregnancy, so it's quite a special club to be part of. Now, in terms of when your babies are going to be born, a lot of that will be based on what happens during the pregnancy in terms of the size of the babies, the growth of the babies, and in addition to that, any complications that might arise during the pregnancy in terms of your own health. Things like high blood pressure, for example. Now, we know on average that around about 60% of all twin babies are born before 37 weeks. Now, when you compare that to a single baby, that's around 8%. And so largely the reasons will be based around what's happening with the pregnancy, what's happening with the babies, and what's happening with you, ultimately tailored to get the most optimal time to birth and to make sure that you're taking really healthy and happy babies home with you. So there are two different types of twin pregnancies. There's what we traditionally term the non-identical twins, where a woman's ovulated from 2 eggs, and that subsequently means that the babies are not identical. They're effectively 2 separate babies. And there's also babies where they are born from, or they're conceived rather, from one embryo that subsequently split, and these are the identical twin babies. And both these types of twins have different complexities in terms of their management during pregnancy, and in addition to that, also differences in terms of when the babies need to be born. Now, with a twin pregnancy where the babies share one sac and one placenta, we might consider bringing those babies out pretty early, around the 32-week mark. And so that will, generally speaking, be via a cesarean section. For all other babies, we consider birth around that 36 to 37-week mark. Now, ultimately, the decision based on the mode of birth will be made in conjunction with you and your obstetrician. In some cases, it may be more advantageous to consider a cesarean section, but in some cases where the environment is really ripe and right, and you're really willing to have a vaginal birth, particularly if the baby's heads are both head down, then we will definitely consider a vaginal birth. And they're some of the most rewarding pregnancies and birth experiences that us as obstetricians get to be able to care for you.